I'm a facial plastic and reconstructive surgeon in Richmond, Virginia. I'm going to talk about post-operative care after septorhinoplasty or rhinoplasty or other varieties of nasal surgery too, because there's some simple basics I recommend most people, and then of course individuals will have other details too. So immediately after a nasal surgery, I would advocate keeping someone's head elevated for the first week. Any swelling that we can minimize up front means there's less swelling to go down with time. Ice helps both swelling and discomfort and helps minimize bruising. So on that note, we do advocate ice. Perhaps on an aggressive way, you might do 20 minutes on, 20 minutes off for the first 24 hours. Ice will help for the first 72 hours after a procedure. After that, warmth actually will help more in returning vascularity and helping flush out swelling. And so we transition at 3 days for those who are really motivated to press that. Those people who have the toughest time after nose surgery have a kind of claustrophobia related to some of the swelling and the gumming and crusting up of the nose. So I strongly press people to roll ointment and perhaps use saline sprays and gels intranasally. I do like people to roll a Q-tip, the length of the cotton on a Q-tip, inside the nostrils gently, and perhaps use some clean tweezers to pluck out any gummy or crusty stuff. If you can keep the breathing channels of the nasal splints, if those were used, open, there's less of the claustrophobia. You can maintain a nasal airway through the post-operative recovery until we remove those at around day 3 to 5. With regard to other general recommendations, I'd say no heavy lifting, the main risk being a nosebleed. That's of course a surmountable risk, and so we just like people to use common sense regarding that. With regard to pain control, the mainstay for pain control is ibuprofen. The surgical dose is more like 600 to 800 milligrams, depending on the person's size, on a 8-hourly or 3 times a day basis. And then we'd have people alternate with either Tylenol or with the narcotic that will also contain Tylenol. And with time, people can back down on both dose and frequency. Though remember, ibuprofen is the mainstay, doing better for bone-related pain than the other two analgesics. While rubber splints are in place, it's important to be on an antibiotic. We generally prescribe it for a week, though once the rubber splints are out, it's reasonable to stop it at that point. When we see people post-operatively, somewhere in the 3 to 5 day range, we'll remove rubber splints if appropriate. We'll remove the cast over the bridge of someone's nose if appropriate, and we just check the status quo of the post-operative nose, the healing nose. For those who have had a nose straightening procedure, there are these nasal finger exercises or nasal massage, which we encourage to help mold and help the nose remodel as it heals. As the swelling goes down, the nose can cant left or right, or sometimes the memory in a nose can influence how it settles. And so encouraging someone to influence that healing is important to get the best straightening results. Otherwise, we're available. We want you to call us. This is a team process, and we don't expect people to go through this but once in a lifetime, we hope. And hope all is well. Hope your surgery goes well if that's why you're looking at this, and call us for trouble.